And then edentulous scanning. Edentulous scanning is a commonly feared scan. And I think, again, it just comes down to scan strategy. And I will show you what a scan strategy is for an edentulous scan. This is something I have covered in previous webinars, so I don't want to keep repeating myself. But for an edentulous scan, like a maxilla here, you always start in an area where there's a lot of reference points. And here, if you can see the laser pointer, it is obviously the rugae. This is a good area to start your scan. And from there, you will go down the tuberosities and just start building that tuberosity scan. One thing to realize, guys, is that scanning anything is easy as long as there's no movable tissues and the area is dry and not overly shiny. So if you're scanning something like this, you definitely want to make sure there's no external lights. Just like when you're scanning metals, you need to turn off your overhead lights. You don't need to turn off the clinic lights. That's a bit too much. But your overhead lights, your loop lights definitely need to be turned off. And I routinely turn them off for all scanning. Now, after you've done the tuberosity, you go down and you scan the palate. This should be the last thing to scan. And the palate, some people have issues scanning because they don't realize they need to move deeper into the palatal vault as they're moving side to side. You can't stay at the same vertical height. The only thing that's hard about scanning an edentulous site is the soft tissue management. And I would highly recommend, if you're doing a lot of edentulous scanning, you invest into some really good soft tissue retractors. There's the ScanMate retractors. There's retractors by Lo Rousseau. Some really, really good soft tissue edentulous retractors, because if you retract the soft tissue well, and I'm talking about the cheek, the tongue, I promise you guys, these are not hard scans to do. It is commonly feared, and frankly, it just comes down to soft tissue retraction. Then the bite registration as well is something that people kind of get confused about, especially with edentulous patients. How do I take a bite registration? It's really straightforward. You need some sort of wax rim or old dentures or something like that. There's no way around it. You can't just get the patient to hover in midair with an edentulous arch and take a bite. Okay, so if you have an old denture, the beautiful thing about the Medit software is it makes the workflow really easy. Here you can see a scan of a denture, and you always scan the denture from the inside because that is the less shiny side, or the intalio surface, and then you move towards the outside. And the really cool thing about the Medit software is that it gives you the workflow. You can see that it tells you to scan the edentulous and then the denture. And the software itself will actually join those. So then you scan the lower edentulous, the lower denture or wax rim or anything, any bite registration index, and then you scan the bite in the mouth. If it was the dentures, you would scan the denture bite.